And it's my pleasure to welcome now Moshe Siman-Tov, Director General in Ministry of Health. Thank you very much.
Good evening. Our healthcare system is forecasted to face great challenges in the upcoming years. This includes the dramatic aging of our population and frequent use of health services by the aging baby boom generation. The effects of our unhealthy lifestyles leading to a significant leap in the prevalence of obesity and other non-communicable diseases. The unbalanced private-public mix in our system bringing to the risk of the creation of two healthcare systems, a public system for the less privileged and a private one for the rest of the population. However, today I chose not to focus on these challenges, rather to speak with you about the greatest and most exciting solutions and opportunities that we at the Ministry of Health are developing towards these challenges, our digital health revolution. The digital revolution changes the actual health processes. It impacts the basic interactions within the system, and it also affects the role of the regulator, our role. In health, as in many other fields, the future belongs to those who will make the best utilization of technology and data. And due to the centralized nature of our healthcare system, we are able to utilize data towards primary and secondary use probably better than any other country in the world. So we are here to discuss the future of MedTech, and as they say, we should be here. As they say, today is yesterday's tomorrow, so before delving into our future, let me talk a bit about our present, our day-to-day life. We can proudly say that Israel has developed one of the best and most efficient healthcare systems in the world. Israel's healthcare system ranks 7th among the OECD countries, with high life expectancy and low infant mortality rates. The OECD defined Israel as having one of the most enviable healthcare systems in the world. We also received one of the highest scores in the Bloomberg Healthcare Efficiency Index. But the role of the healthcare system in Israel is much more than just supplying health services. The role of the healthcare system in Israel is much more than just supplying healthcare services. Our social and geopolitical complexities has also created both the necessity as well as the opportunity to designate health as our bridge connecting between the different subgroups composing our society. Our health needs serve as the threshold for our social solidarity. And this being said, I cannot emphasize enough how important it is to ensure the stability of our healthcare system and its ability to maintain its fundamental principles of equity, social justice, and social solidarity. And as impressive as our healthcare achievements may be, a crown is not secure for all generations, lo leolam chosen. And it is our duty to do whatever it takes to assure the resilience of the system for future generations. As you all know, in Israel we have universal healthcare coverage with 4 competing HMOs, Kupot Cholim, and everyone in Israel is entitled to a comprehensive healthcare basket. What you may not know is that no other country in the world with universal healthcare coverage spends so little nationally on health and has such a low share of public funding. Israel spends only 7.5% on health. This figure is significantly lower than the OECD average of 8.9%. Private funding in Israel accounts for 40% of the overall health funding. This is one of the highest among the developed countries in general and the highest among countries with universal healthcare coverage. These figures create a challenge in and of itself. You know, over 60 years ago, David Ben-Gurion said that in order to be realist about Israel, you must believe in miracles. So given the scarce financing of our healthcare system, the high quality of services that we deliver to our population is indeed a medical miracle. This miracle can be explained by a number of factors. First, efficiency. For example, Israel's hospitals have one of the lowest average length of stay and the highest occupancy rate, but we still maintain very impressive healthcare outcomes. Second, the Ministry of Health is the dominant key player with multiple roles. The ministry acts as a policymaker and regulator and also owns and manages general, psychiatric, and geriatric hospitals. This complex structure allows for well-coordinated operational processes involving the healthcare system in its entirety. Thirdly, and most relevant to this conference, the Israeli innovative nature and out-of-the-box mentality also applies to the healthcare field. In Israel, the rising demand for services alongside the scarcity of resources consistently drive us to innovate and integrate technology into our healthcare system. Our larger HMOs, Kupot Cholim, and hospitals serve as innovation greenhouses within the public system. Over the past 5 years, the number of digital health startups in Israel has tripled. We strive to utilize health data to create data-driven guidelines for policy, regulation, quality improvement, and research. We do so both on the patient and system levels through a number of venues. Historically, since the mid-80s, we have computerized and digitized most of our medical services. Today, over 99% of the population in Israel have electronic medical records, EMRs, leading to a comprehensive database with over 2 decades of longitudinal, diverse, and integrated data. In our small country, Clalit, the largest HMO, holds the second largest medical database in the world. Maccabi holds the third largest medical database in the world. The fact that our medical system is computerized and integrated almost in its entirety has enabled us to create OFEC. OFEC is a nationwide data network health information exchange program that focuses on data sharing between providers. Under our strict privacy by design policy, OFEC enables the sharing of patient data and history without having a central national electronic medical records. OFEC already operates in all general hospitals and HMOs. It improves the continuum of care by creating a continuum of data. So when a patient is admitted, the hospital staff can view his past medical information from distributed sources, including the patient's HMO and any previous hospital admissions. This has tremendous safety implications, including information regarding medication intolerances and treatment history, which are now available to the medical team at a click of a button. Following discharge, the hospitalization summary is electronically transferred to the patient's HMO. You can imagine how priceless this is, especially when dealing with the elderly and more complicated patients, many of whom have rich patient histories with multiple comorbidities and polypharmacies. I presented the OFEC system a couple of months ago in a conference in Washington, D.C. I cannot overemphasize how rare for a country to build a healthcare system at the national level inherently based on interoperability alongside integration and sharing of health data. We know now that there is no other country that does it as good as we do it here in Israel, and we do not plan on stopping just yet. We are now working on the next generation of OFEC, EITAN. By dramatically improving the system interoperability, EITAN will enable much better utilization of the transferred data. EITAN will enable physicians to identify and act proactively in patients' pre-crisis and pre-disease situations. It is completely in line with our general paradigm shift at the Ministry, in which we are adopting a more proactive, health-promoting, disease-preventing approach, both on the individual and on the population levels. And as I said before, the digital revolution also changes the role of the regulator. We find that directing the system can be easier and much more efficient when we take on the role of the enabler. So we incentivize field innovation and build the necessary infrastructures in addition to the traditional role of the regulator of just giving directives. Over the past years, the Ministry of Health has developed numerous technological data-focused tools designed to enhance our health system management capabilities. One example is a pilot over big data national infrastructure taking place now in Israel. We wish to build the necessary system pathways and enable various organizations to join us along the way. Another example is a command and control application that enables us to direct the loads in the emergency departments based on quantitative assessment of processes. The data is gathered through a queue flow management tool that will be implemented nationally in all ERs. This tool also serves as the basis for patient application that directs the patients through the ER process. Another tool is a quality indicator dashboard. It provides a real-time snapshot about the different indicators for us at the Ministry as the regulator and for the service providers as well. It enables us to adjust policy developments in a dynamic environment. The Ministry also makes smart analysis regarding the distribution and the availability of community services. Accordingly, we give directions to the HMOs aimed to reduce gaps and disparities. So what is next? The future in health lies in the massive use of data tools and digital health applications. The upcoming years are filled with tremendous healthcare challenges. Advancing digital health is the next essential step to overcoming these challenges and improving healthcare on all levels. We have chosen as a national strategy to focus our innovative energy towards developing these capabilities and tools. The world in which we are operating today transforming constantly. Yesterday's solutions becoming irrelevant to today's problem. And policymaking nowadays is more and more like Wonderland. You must run as fast as possible just to stay in the same place. And if you want to get elsewhere, and we certainly do, you must run twice as fast. So we have the opportunity and the determination to lead this transformation and become a global leader in the field of digital health and digital health utilization. So on this note, I invite you to join us on this fascinating journey and wish us luck. Thank you very much.